Good morning, my friends. This is Professor Dr. Tarek Ali. A reminder from me about respiratory viral infections, which is common in this season, in that season of early autumn, late autumn, and winter season. We get a lot of cases of respiratory viral infections. In most of the popular respiratory viral infections, with upper respiratory manifestations, including flu, runny nose, stuffed nose, sneezing, and sometimes with sore throat, and sometimes with laryngitis and bronchitis. In those cases with upper respiratory symptoms, which I mentioned now, plus or minus other general or systemic manifestations like body aches, myalgias, arthralgias, bony aches, lassitude, headache, and backache sometimes there, and of course fever. Fever should be present in order to diagnose an active infection, whether viral or non-viral. There must be fever, at least low-grade fever. The degree and the severity of fever differs between viral infections. For example, in common cold or flu, which is caused by rhinovirus, the temperature or the fever is usually low-grade. In influenza and in parainfluenza and in respiratory syncytial viral infections, the fever is usually high. And low-grade fever means a fever between 37.5 to 38.5. If more than 38.5, this is high fever. So the severity of fever depends on the underlying viral etiology, which virus is the cause. Anyway, in all patients with respiratory viral infections with upper respiratory, I mean that there is no lower respiratory manifestations. For example, there is no features of involvement of the lower respiratory tract, that is the lungs. There is no symptoms and or signs of pneumonia, which is inflammation of the lung parenchyma, which is dangerous if there is pneumonia. If there is lower respiratory symptoms, start to be careful that the patient might get complications. But in patients with upper respiratory symptoms, with general manifestations, as I mentioned, the fever, the chills, the body aches and myalgias, and the headache, and lassitude, and prostration. In those patients, if the patient is not having a chronic medical disease, and is not immunodeficient, for example, he is not diabetic, not with chronic renal disease or chronic liver disease, or taking any drugs which suppress the immunity, like immunomodulators or steroids, or patients with other hereditary or acquired immunodeficiency states, those patients are high risk to get complications. They are vulnerable to complications. In those patients and in patients with severe symptoms, we have to take specific antiviral medications. The most common and the most famous is the oseltamivir, the Stamiflu, or oseltamivir. So, oseltamivir is indicated for patients with severe symptoms, which are causing a lot of distress and limitation of the daily activities of the patient, and in patients who are liable to complications, which I mentioned them, all patients who are with immune deficiency by chronic disease, like diabetes, like kidney disease, liver disease, cancer, or under other medications which suppress immunity. Here we have to take specific antiviral medications, and to attack the virus aggressively by giving specific antiviral medication in a suitable dose for an average of 5 days up to 10 days or 2 weeks even. But in patients with mild symptoms and who are not liable to any complications who are otherwise healthy, there is no need to take any medications. The condition will subside by itself because the virus has a natural course, and it will finish by itself even without giving antiviral medications. And here it's wise not to give medications in such cases with mild symptoms and who are otherwise healthy with no underlying chronic medical disease which makes him or her liable to complications. Such patients do not need any antiviral medications, just to control the symptoms until the disease and the nature cures the problem by itself, and the viral biological behavior will subside and it will finish by itself within a few days or maximum several days. During this time, you can give the patient symptomatic treatment like some analgesics, antipyretics. No need to give antibiotics also, because antibiotics, they are not used for viral infections. Antibiotics are for bacterial infections. This is a very common mistake done by patients, public, and even by some doctors who encourage this bad habit of antibiotics in viral infections. A totally and absolutely wrong tradition. Don't take antibiotics for viral infections, please. And in addition to giving pain relievers and fever relievers, give some other remedies which are not drugs, like give some ginger, some lemon, eat all fruits which contain or which are rich in vitamin C, like citrus fruits, orange, grapefruit, lemon, lime. These are good to limit the course of the viral infection and abort it quickly. Lemon, in addition to ginger and to honey, the three things together, they are natural remedies for viral infections if you take them as a drink twice daily, as early as symptoms of the viral infection start to appear. So the mix of lemon with ginger and with honey is a very good natural remedy for mild viral infections when given early in the course of the disease, early after the appearance of the or after the onset of symptoms of the viral infection. So no need to rush for antiviral medications except in certain situations, as I mentioned them, and no need to give antibiotics at all in any viral infections, and try to focus on symptomatic relief and give the patient time for the natural course of the virus till it heals by itself. Thank you so much and have a nice day.